Welcome to the TMC PROM system. We have developed this website so that people can provide us with their information regarding their quality of life and symptoms. The website is https://prom.chavi.ai, and if you visit this website, this is a very simple page that appears, and patients can directly choose the language they want to answer the questions in, and they can log in. Everybody has to log in order to provide the answers to the question. So let us log in as a test patient. We can either log in from here by clicking the login button, or by logging in by putting the ID over here. So let's directly log in as a test patient. Once we log in, we can see we are directly taken to this web page where the patient's questionnaires are shown. Now these questionnaires are designed for the PROPARA study, and therefore there are two questionnaires available for the patient: the EORTC QLQ C30 questionnaire and the CX24 questionnaire. Now this page shows what is the number of questions in the questionnaire, what are the times that will be taken, and what are the reasons why we are asking this question. In order to answer the questions, the patients will click the button which is located over here. Now please remember that this language can be changed. So if I change this to English, it will be changed to another language, and if I change it to Hindi, it will be changed to another language. Now because the system has been configured that the account language takes precedence over the button language, therefore we can see that it is only showing the Hindi language with which the account has been configured. It is possible to configure other languages per account. Let us start by clicking the answer, and we can see that this brings us to this page which allows us to start answering the questions. Each question is presented one by one, and the patients are provided with these four options which allow them to answer the question. In addition to the text, we also provide them with the numbers so that they can understand the score. Clicking the button will automatically move it to the next question, as you can see. So the patient does not need to click these buttons to navigate back and forth for the questions. However, if they wish to go back, they can click this and change their answer. So this is the URTC QLQ C30 questionnaire. We will quickly answer these questions so that we can go on to the next section. And you can see that as the patient is answering the questions, automatically the questions are moving. Now this is basically the question which are related to the health and quality of life, and these have a different appearance because patient has to choose a score between 1 to 7. Once they have selected the last answer, it automatically forwards them to the next EORTC QLQ CX24 questionnaire. Again, the same mechanism will work. Patients will need to answer the questions. Appropriate script logic has been put so that if there are questions which need to be skipped based on the answer of a particular question, they will be skipped. For example, here we are only seeing 17 questions, not 24. Once this is done, it gives them an information as that your information or the answers that have been selected have been saved properly, and the patient can log out of the system. So this shows the overview of the patient part.